Okay, I'm going to prepare my medication to administer. I've got my doctor's orders here, so I'm going to go ahead and start my first medication check. I've got orders to administer Humulin R, 8 units subcutaneously right now, so at 11:45 on March 10th, 2025. I'm going to be administering this to a Foley Ferdinand, born 9/23/1969. He has no known drug allergies, food or drug allergies, and the expiration date for the medication is 12/2025, so it is within date. All right, I've performed my first medication check, so now I'm going to gather my supplies in the medication room. Here I've got my medication, my insulin syringe, my label for the syringe that I'll prepare in a moment, my alcohol swab, barcode scanner, gauze, sharp something over here, gloves, sanitizer, and my MAR. Okay, so now I'm going to go ahead and perform my second medication check. I've got my Humulin R. I'm going to be preparing 8 units to administer subcutaneously right now, so at 11:45, to a Foley Ferdinand for 9/23/69. He has no known drug allergies, and the medication is within date. It is not expired until 12/25. Okay, now that I've got that prepared, I'm going to perform some hand hygiene and don some gloves so that I can go ahead and get the insulin prepped in the syringe. All right, so here I've got my insulin syringe, I'm going to remove this cap, this down. I'm going to pull out my 8 units of air. Going to pull the cap straight up, making sure to set it down, trying to avoid contamination. I'm now going to take my vial. Actually, I'm going to cap this real quick. Got ahead of myself. I'm going to first clean the vial off with this alcohol swab, juicing it 10 times. Okay, now that it's clean, I would also roll this if it weren't Humulin R, if it was cloudy, but this one is clear, so I don't need to roll it or agitate it. Now I'm good to go ahead and remove the cap of my syringe. It's already got the 8 units of air, so now I'm going to, at a 90-degree angle, go ahead and puncture the vial and press my air in there. And now, holding this with my dominant hand, I'm going to invert the vial and pull out my 8 units. Okay, now that I've got my 8 units, I'm going to carefully remove the syringe, making sure it's from the needle. And now I'm going to check and make sure there are no bubbles, that it is at the proper unit. I'm going to tap in case there are any bubbles. There are none to be seen at the moment. I'm going to carefully recap my syringe so that I can have a second nurse go ahead and check and make sure that I've got my units correct. You can just see that there is 8 units in there for me. Thank you. Okay. So now that I've got my insulin prepared in my syringe, I'm going to go ahead and set it over here and do my final medication check. Go ahead and remove these gloves for now and discard them. All right, so for my final medication check, I'm going to make sure that I've got my Humulin R. 8 units are prepared within the syringe. 8 units are going to be administered subcutaneously right now at 11:45. I'm going to go ahead and initial the MAR to keep my documentation good. And I'm making sure that this is being administered to a Foley Ferdinand, born 9/23/1969. He has no known drug allergies, no known food allergies, and the medication does not expire until the 12th month of 2025. Okay, now that I've got all that set up, I'm going to go ahead and label my syringe. Get my label ready. I'm going to write in the Humulin R, 8 units, time and date. It is 11:45 of March 10th, 2025. All right, this is all prepared. So I'm now going to go ahead and get ready to enter the patient's room. Okay, exactly right. All right, so I am entering the patient's room, performing hand hygiene, introducing myself. Hi, my name is Danny. I'm going to be your student nurse for today. We're going to go ahead and do an insulin injection for you. Just we want to get this done before lunch. Do you mind to go ahead and verify your name and date of birth for me? Okay, let me check your wristband. Foley Ferdinand, born 9/23/1969. Perfect, that matches up with what I have. So since I've got your wristband right there, if you'll just hold that for me, I'm going to go ahead and scan it. Beep. Cool. And now I'm going to scan my label. Beep. All matches up, looks good. So I'm going to go ahead and don some gloves. Now I've got some options for this injection, a few different sites that you can choose from. I'm going to let you choose. We've got the option of doing the outer aspect of your upper arm back here, or we could do around 2 inches around your belly button, your umbilicus. We could also do the anterior aspects of your thighs. We'll have to do it about a hand's width below the greater trochanter, or a hand's width above your knees, just that middle thigh area. Or we could do the ventrogluteal area, which is in between your greater trochanter, your hip around here, and your iliac crest. And then finally, if you want, we could also do on your back the scapular area, the skin around that. Do you have a preference? Yeah. Okay, so we'll do the upper and outer aspect of your arm. We'll do your right arm. Sounds good. In that case, I'm going to go ahead and grab my alcohol swab. And I'm just going to assess your skin real quick, making sure there's no bruising, erythema, the skin is intact, there's no bony prominences, you've got enough subcutaneous tissue for us to administer here. So now I'm going to go ahead and sanitize the area with the alcohol swab. Yeah. I'm going to take the swab, and in an outward spiraling motion, I'm just going to clean 2 inches out from the injection site. I'm going to go ahead and discard my swab. Now I'm going to prepare my injection. Going to uncap the needle, straight up. I've let this alcohol dry, just air dry on the skin. I didn't want to blow it or fan it off, so it's dry now. I'm now going to take the needle, and at a 90-degree angle, since it's insulin, I'm just going to pop into the skin. We're going to wait for 10 seconds after I've administered. Since there's liquid in here, I'm not going to actually push it in, but if there wasn't liquid, I would slowly push the full amount of medication into the patient's skin, subcutaneous tissue. After 10 seconds has passed, 10, I will then remove the needle, pulling straight up at that same 90-degree angle. I will then recap the medication, put it in the sharps container, take my gauze pad, hold gentle pressure against the injection site, making sure not to massage it, but just holding to make sure that there's no excess bleeding. All right, once the pressure is done, I'm going to go ahead and get rid of those. I'm now going to discard all my unnecessary equipment. This is in the sharps. These are all going to be thrown away. Discard. Now that I've done that, I'm going to go ahead and just check on the patient, make sure that he's all comfortable and safe. His top 2 bed rails are up, bed is low locked, call light is within reach. He's feeling okay. So I'm going to go ahead and perform some hand hygiene as I exit his room, making sure that I've got the MAR documented correctly. In doing so, I would make sure that I've got the time correct on there, my initials. I'm also going to document that the injection site was in the outer aspect of his upper arm, on his right arm. And I'm going to mark out the time that we did it, just to show that it was administered. Push that down. And yeah, I think that's it.